Welcome to Conversations with T, the podcast where we have organic and down to earth conversations exploring the field of perinatal and maternal health and the intersectionality of spirituality and psychology. I'm your host and sister friend, Shatia Tee Owsley, and each episode we will take a deep dive into the outstanding and sacred work of BIPOC birth workers, spiritualists, and other holistic health professionals making tremendous impacts in the world of birth. So grab your headphones, a warm drink, sit back, and let's vibe out together. Today, our special and amazingly dope guest is Dr. Jordan Etters-Boyd. I am so excited to chat with you today. So let's just jump right in. Jordan, thank you for being here.
Yes. Hey T, how you doing?
I'm doing so good.
Good.
So tell us about yourself. How did you get started? Where did birth work come from? Just who is Jordan? Who is Dr. Jordan? Who are you,
Okay.
girl?
All right. So I'm Jordan, or Dr. Jordan, as most people know me now. I am Texas born and raised, born in a small town called Clarksville in that northeast corner of Texas, and grew up with a very holistic minded mom
Oh.
and dad actually. um Even though we used a lot of things with like I needed to go to the doctor a lot. I needed to go to the pediatrician a lot. I always had like upper respiratory issues and things like that, but as time passed we figured out ways to get over that. And as then learning about my ancestry and my great grandmother on my mom's side, she was the herbalist.
Mm.
People called her sister. She would go out into like like the woods, the fields or whatever to find herbs and help people.
Mm.
So now coming into this, as time moved on, I went, got my biology background, moved into like the Eastern medicine side, became an acupuncture and TCM or traditional Chinese medicine doctor. And, all of this happened within like between, I would say, started my journey 2008, in college, getting that bachelor's degree, moving on to the master's program for acupuncture and Chinese medicine. That was like 2015, finished that 2019, and then, got licensed, all of that stuff, right?
Mm-hmm.
And so, started focusing on like menstrual cycle
Oh.
care. Like even when I was still in school, I was starting to help women with their wombs and getting into that, not really thinking that
Mm-hmm.
this would become a thing. So moving on, 2019, started working more with pregnant clients and pregnant women and fertility issues, menstrual cycle issues, and it started to become a thing, like my
Mm-hmm.
thing. And so, of course, circle into 2023 last year, a doula course comes up
Mm.
through the March of Dimes, and the program is called Depth. So it's the doula expansion program throughout Houston,
Mm.
and it's sponsored by the March of Dimes and some other like sponsors like that are like insurance carriers and different healthcare services. So they're seeing that there is a great need for birth workers and doulas to support every woman
Mm-hmm.
because I don't know if anyone knows, but Texas does have one of the highest maternal mortality rates, and especially Houston. And
Mm.
it's like the Texas Medical Center is like the biggest medical center here in Houston in the world.
Mm.
How can this be happening, right? What is being
Mm-hmm.
missed?
Mm-hmm.
If
Mm-hmm.
if we can't do it here,
Right.
what's going on?
Right.
So, of course, now I'm in Houston. I've been in Houston since 2008, since I started at Prairie View A&M and then, graduated all that, just never left. Like
Mm-hmm.
this is home now. So, um, so now coming into that doula program, we were matched with 3 clients. We worked with those clients. I started with them in autumn of last year, and
Mm-hmm.
then started taking on my own fully at the beginning of this year. And
Mm-hmm.
so I just had my 10th birth. Um,
Congratulations.
thank you. And it was a successful home birth. So I'm very excited and happy for the family that I just served over the weekend.
Yeah. Oh, congratulations.
Thank you.
Congratulations. So did you just like so many points that you made, just thinking back to when you went to school,
Hmm.
going to school, is this where you saw yourself being an acupuncturist, being a doula, doing holistic? What was your ultimate goal when you went to school?
So I was between being a medical doctor or
Mm-hmm.
going to dental school.
Mm-hmm.
I was really trying, but I always had this holistic mind background, but
Mm-hmm.
I was not fully aware of, or I'll say this, I hadn't really seen an example of someone working in a field like this. And so, when you're, going to school for like something like that, you're going to be, you're more Western minded, even
Mm-hmm.
though I still, had all of this like, knowledge from, growing up, like, this is what you do, this is how you take care of a cold. You don't just go get antibiotics, you make sure that you take care of yourself type things, or even just simple things like how to eat properly,
Mm-hmm.
things like that, just knowing those things. But I wanted to, in my mind, I felt like, okay, once I get this degree and this doctorate or whatever, then
Mm-hmm.
I can start doing that. But of course, God is like, well, nah, that's not how this gonna work. And you actually
I
gonna
had
have
a
to
different
fully,
plan.
right, you actually gonna have to fully immerse yourself.
Mm.
Now I finished with my biology degree. I did do all of that, right? I
Mm-hmm.
even I even studied for those tests. And
Mm-hmm.
something was, like spirit was not allowing me to get get past that. Like
Mm-hmm.
I never took a test.
Mm.
And I know that I could have excelled. I know that I could have done this. And it's
Right.
one of those things like, just because you can, should you? Is this what I'm
Mm-hmm.
supposed to be doing? So
Mm-hmm.
it was like I would always get some kind of like roadblock, like that would
Mm-hmm.
come up, where I would either need, like I had even like gone as far as paying for a test, signing up for it for the MCAT.
Mm-hmm.
I was gonna like take it in Louisiana, like 'cause that
Mm-hmm.
was like the closest place for that time frame.
Right.
And so I had signed up for it and something came up, and I don't know, I forgot exactly what it was, but I refunded the money, and I was like, okay, I'm gonna table this. And
Mm-hmm.
so I was like, I'm gonna wait until I'm finished with my undergrad program so I can focus. So I'll
Mm-hmm.
work and then I'll focus. And then just no. It just wasn't coming together. And I was like, okay, I'm gonna stop fighting this.
Right.
And then once I started really getting into like womb care and
Mm-hmm.
what was really going on with the female reproductive system, and seeing that how many problems we're having with that, and,
Mm-hmm.
and learning about birth control and what it was doing, even learning
Mm-hmm.
about what just products you buy from the store do to us, like our menstrual products and things, the
Mm-hmm.
pads and the tampons. So starting to go into that, I was like, okay, I am not going to be able to work how I want to work in this sector. So
Mm-hmm.
this is not where I need to be. So then I started searching. So I was like, okay, let me, like, what can I do? How can I be like a holistic doctor? Like,
Right. Right.
that exists still, does that,
Is that a
like,
real thing? Is
that
that a
real
real
thing,
thing?
because you hear about it, you hear about like
Right.
naturopaths. I've even heard of an acupuncturist, but I didn't know. I was like, does anybody go to them? Like,
Mm-hmm.
even like, are they respected? Because, it's like, if you don't have it, if you don't have like if you like spend this time, learning that, these are like, professional degrees, right? You're spending time, money, like hundreds of thousands of dollars.
Lots of money.
Yeah. Once I come out, like, what's going to happen? So,
right. Are you gonna be out here painting? What you gonna be doing?
Like, what am I going to be doing?
Right.
So, because, my parents like raised me, they was like, always have multiple plans. You have my dad, especially my dad, he's like, you gotta have plan A, B, and C. Make sure that you can always have something going for yourself. And so, I got all this stuff in the back of my mind, and I'm like, I'm nervous, I'm scared, but I felt spirit led to just go ahead and jump. I had, I've had some a lot of encouragement as well. Like, so especially for my friends, my husband, who was my boyfriend at the time. And so, just having that support system really pushed me into, seeing that, because when I was telling them, what it is that I really wanted to do, it was like, they was like, oh, you have to do this. What is needed.
Yeah.
And so when I, learned that more people were wanting to get into stuff like that, or even see somebody that looked like me do this, because that's the reason why a lot of people weren't getting into it, because they didn't know anybody that they could feel comfortable with.
Yeah.
Yeah.
Yeah. And the support makes a big difference in what it is you're doing, especially when you're stepping into unknown territory, or territory that we don't see ourselves in, right? Just going on this journey and doing this work for the time that I have been in it as well. And still even learning more, I learn about these different roles and these different titles. And I'm like, are any Black people doing this? Right. I have gone to an acupuncturist, and I have never gone to a Black acupuncturist, right? And so just to hear, your story and it resonates with me so much. So you go through, you figure out, okay, medical school is not for me. So how did you settle on being an acupuncturist? Like, there are so many different holistic health practitioners out there doing lots of amazing work, but what came to you, or what stood out and was like, yep, acupuncture, is what I want to do. That's why I'm going to take the leap and do that.
So back to Google. So I'll say this. So there used to be this website called, I can't remember exactly. It was like healthcareprofessionals.com, something. It was like a resource basically for like, people that were, I guess like in high school trying to figure out what healthcare profession they wanted to go in. I can't remember exactly what the website is. I don't even know if it's still up, but I was in middle school actually. And so this is before Google. This is like Ask Jeeves, Yahoo search time frame. Right. So,
you showing our age, Jordan. You showing our age, okay?
Like, right, I am.
Yes.
People need to know this though, that there was a thing before Google.
Girl, we had rotary phones.
Right.
Take it
and used it.
Right. Yes. Okay.
Why did we have it? Okay, focus. So I saw that acupuncture was a career at the time in middle school. And so in my head, I was like, oh, that's interesting. But, I always wanted at that time, I wanted to be in healthcare. I did want to be a doctor. I wanted to help others heal. And that was always my goal. But, as you kind of progress, you find out that there are so many avenues to help people heal. And so as time moved on, I got back to that. And, once I got out of school, I felt like, okay, I can kind of like focus, I guess. Like, I can see some other stuff. So I got a chance to kind of zoom out and kind of see everything else that could be offered. And so went back to that. And so I looked, I typed in, then by that time, fast forward to Google time, typed in like holistic healthcare professions. And so a list comes up. You got naturopath, chiropractor, acupuncturist. And so I was like, acupuncture, that's interesting, because I remembered that from that time. And I was like, oh, let me go back to this. Let me do some investigation. I was like, is there a school in Houston? And there's a school in Houston. And I was like, I'm going to go visit. And so, I started doing my investigation. I go visit, I get the course syllabus. So, the whole like 4-year degree plan type thing. Because even though at the time they were only offering like the master's level degree so that you could get your license, it was a 4-year degree program. So things are different when you're dealing with holistic healthcare type degrees sometimes, because of how how things the bureaucracy that we have here,
regulations, laws, all the red tape, all that stuff.
Right. So they don't want to, they're just now making those degree programs, doctoral programs straight up, because outside of that, you have to do like a 4-year master's degree and then get your PhD was an extra 2 years, maybe 3, maybe 4 to get that. So you have to go to school for a very long time before you can actually call yourself a doctor in this field. But so I looked that up. I looked at what was offered, like what they went into. And so I liked that it was biomedicine mixed with like the Eastern medicine, the herbs, the acupuncture, being able to be hands-on, being able to put your hands on somebody, because I remember how the art of medicine, was being was getting lost here, where you did have doctors that used to put their hands on you, touch you, really
tap into you.
They really knew that art. And so, because it is an art as well as a science. And so learning that, they still hold on to those traditions. They still hold on to things that that can really help nourish a patient in need at that time, because I've been in positions where, and I'm kind of going off course, I've been in positions dealing with various health issues, going to the doctor and just not really feeling like we got anything done. If that makes sense. And so, like, we just kind of talked. We really didn't, you ask questions like, okay, what should I do? Like, what should I be doing? Right. What should I be eating? And, being told, like, seriously, I've been told this, like, just eat how you've been. And it's like, well, if I do that, then I'm still in the same place. So, so learning that the traditional Chinese medicine system, or even the Eastern medicine system, is like a whole system on its own. It can really stand on its own, because they have the acupuncture component, which can help move energy through your body. We actually acknowledge that there's a such thing as chi and energy and frequencies that move around, that you interact with, right? Like inside, outside influences, using herbs to help as medicine, right? Using food as medicine, movement as medicine. So using like things like qigong, tai chi, and then those are the movements that you would do, physical movements. Then going into like cupping therapy and moxibustion therapy, and being able to have all of these tools that you can use to help somebody. They come in day one in your clinic and they can leave feeling better, and not having to wait on a prescription to be filled or wait for that prescription to kick in. But chances are that person already has, like, they feel like, okay, I have a solution that I can work on already. So that's what I wanted.
Yeah, I love it. I used moxibustion during my fertility journey with my rainbow baby. So I love to hear it. And so I feel like, that point that you made is a great segue. How can families who want to take a holistic approach, and if this is maybe their first time hearing about how acupuncture can help and the benefits of acupuncture, or they have heard about acupuncture, but they have been a little bit hesitant on
Yeah.
it. What are some, just a few benefits
Mhm.
that you have seen in the families that you have worked with using acupuncture on whether it's preconception and pregnancy or postpartum?
Mhm. So one of the first things that I notice is nervous system regulation.
Mm,
So a lot of people come in, they are stressed out because they have all of the things going. They've already
mhm,
been trying all of the things, maybe. And so they come in, I go through like my whole system, how I do my we have our own like diagnosis system and things like that.
mhm,
And we go through that, and then I usually notice like one of the main components is stress. So
mhm,
let's work on that first. And so even though I can do points that will still work on what the underlying condition is, but like if you're stressed out, then nothing else is really going to work really.
right, right.
So they come in, they get a chance to calm down, right? We
Mhm,
start the session. I kind of work them into the session. So we take some deep breaths. Maybe I'll use some essential oils. Now I'm incorporating like tuning forks, which is like a vibrational healing therapy to
mhm,
kind of like, you know,
yeah.
bring them into the session. And so um, once they do that, then they get it. Once I put the needles in, they get to take a nap, like 30, 40 minute
Rest.
nap. I mean, you rest, right?
Yes.
And so a lot of people's deficiency is rest and sleep,
Mhm,
and not really knowing what to do with that extra energy that they're acquiring from all the things that they're doing, or the energy that's being drained from them from
mhm,
the things that they're doing. So sometimes it's one or the other. So that's one of the things that I see. And that's with almost any patient. And then
mhm,
um, another thing that comes after that is the digestive system being
mhm,
able to um, do its functions. Because if your digestive system is not working properly, it's like, again, like sleep or anything else. If you're not getting enough sleep, then if you're not digesting properly.
mhm,
So so just focusing on like some really basic things, what we think is really
mhm,
basic, those are major pillars to our
mhm,
health. It's like sleep, rest, digestion, and just even learning like proper nutrition, like how
mhm.
to nourish yourself for the condition that you're dealing with.
Yeah.
Mhm.
Yeah, it's all integrated. And I think that is the beauty of Eastern medicine is they understand that there is a mind, body, spirit connection.
Mhm.
Whereas in Western medicine, you see more treating of the symptoms instead of
Yeah.
really getting to the root cause or
Mhm.
the core of
Mhm.
what's happening and going on. So that's one thing that I absolutely love in about Eastern medicine and what I
Mhm.
have learned too. So um I love it. I love it. So let's see. When you are working, with families and going through the process of, you're not getting them in and out, right?
Right.
It's time that you are taking with them. And to many of us who go in for like a holistic health appointment a first time, it's different because you usually spend more time in the waiting room than you do with the
Right.
actual practitioner. So to be
Mhm.
able to come in to sit with you and for you to really take an approach that is not just, hey, let me give you a little bit of something or tell you something and then go on about your business and move to the next person. No, you're sitting and you're taking that time. And that in itself allows people, I think, just to breathe a little bit easier, to drop the shoulders, to be
Yeah.
present, right?
Yeah.
And to really experience, hey, I'm actually being present so that I can heal and work through
Yeah.
what's going on and what's happening with me,
Yeah.
which is the benefit of holistic health,
It
right?
is. It's all encompassing.
It's all encompassing,
Yeah.
which is so great.
I would say my patients spend maybe 5 minutes in the waiting room, but most of the time it's a minute.
Come on, Dr. Jordan. Come on with that good customer service.
Cause
Yeah.
it's like as soon as I'm done with one patient, I've changed my sheets over and then I walk out and then they usually see me standing there
Waiting.
waiting. And it's not like waiting because I
No,
want them
like,
to hurry up,
no,
but
come on. This is a welcome waiting.
yeah, it's
This is,
more
I'm
so
ready for
like,
you.
a lot of my patients are very friendly, so we'll
Mhm.
hug.
Yes.
It's a very welcoming environment. And, I know like we're taught professionally, you don't hug, you don't do this and
Mhm.
don't do that. But for me, I feel like, once you kind of make that connection with that
Mhm.
patient, and they're comfortable, then yeah, like that works for them, right? That
Mhm.
works for me. So yeah, we don't spend that. They don't sit, unless like,
Mhm.
I had a really long session or somebody came late, which I try to like, text the next patient like, hey,
Mhm.
I'm a little bit behind. So
Mhm.
I'll let them know like, hey, and they're always fine with it because they never have to wait. So
Right. Right.
yeah.
Well, I love it. I think this is such, I mean, the conversation that we're having is just such a rich conversation. And I feel like we can just go into so many different directions with the work, and just how the work that we're doing is interconnected. Just a point about how you make your patients and your clients feel, right?
Mhm.
I just immediately thought community, I thought family, and I think a lot of times is that's what we are looking for
Mhm.
because it provides a sense of safety
Yeah.
where we don't always have that when you're going
Mhm.
into a hospital setting, especially for the BIPOC community. It is not a really safe space, especially if you're looking at the news, you're looking at our numbers, you're looking at
Mhm.
our the outcomes for our moms and for our babies,
Mhm.
or just people not even wanting to go to the doctor to begin with. So being able to have that connection and that rapport with a provider, with a practitioner who, once you do build that relationship, and of course, we're talking about healthy boundaries, right? We're talking about still being professional. But I think in our community, we are looking for a sense of community, right? I'm working
Sure.
with somebody who looks like me, but if I can go in and I can talk to them about what's happening and going on in my life, and I can use a particular type of language, and
Yeah.
they're gonna feel my body language. They're gonna
Mhm.
know what I mean when I say this particular thing. I don't have to over explain myself. That
Right.
in itself makes the experience even better.
Right.
So, I have one more question for you and we're gonna wrap it up. But you got to come back. Are you coming
I'm
back?
I'm coming back.
Okay, coming back. So I just want. My question is: looking back over your life and your experiences, what is one thing that you would tell your younger self? What would Dr. Jordan tell younger Jordan?
Yeah. Um, it's all gonna come together because like it was so many times to where I was like, how am I gonna get to this?
Mm-hmm.
Like how do I do this?
Yeah.
Like you find out, all these like how I explained, kind of
Mm-hmm.
like my path it wasn't straightforward. It wasn't
Mm-hmm.
linear. It
Mm-hmm.
it went up a little bit and then sometimes it would take a plateau and then we would go up and it was just
Yeah.
like stair steps, not really, we didn't just go up. And so I would tell myself like, just focus on the present moment, focus on where you're at right now. Because I spent so much time like in the future, which
Mm-hmm.
created anxiety,
Mm-hmm.
chaos,
Mm-hmm.
mental
Mm-hmm.
chaos.
Mm-hmm.
So that's really what I would tell myself if I could go back and just say, look, just focus on what you're doing right now. Don't try to do all of the things all at once. Like my mom always tried to tell me, she was like, you can't take 20 hours in a semester.
Mm-hmm.
I tried. I did like 17 one time.
I feel you. I did 20.
18.
I did 21. So I was like, I gotta get out of here.
I know. I was trying so fast to get out. She was like, "Why?
Take your
Why are
time.
you trying to get out so
Look, I gotta
fast?"
work. I gotta
I
work.
was like, "But I need to like,"
Yeah.
and she was like, "What are you doing? You're gonna burn yourself out."
Slow down. It's slow down. Take your time.
Yeah. So
I love it.
it's, because it was things, when I kind of look back, it was moments I did really, I feel like I really did live like that Black college experience for sure.
Mm-hmm.
But it was things that I was like, if I wasn't too so focused on trying to like hurry up and get out and all
Mm-hmm.
this, it was like I could have done this too, right? Or
Yeah.
I could have made a better grade here or there,
Yeah.
right?
Mm-hmm.
Because
Yeah.
when you try to like put so much on your plate, you really can't excel at every single thing the way you want to. Like it was certain things that I was like, oh, that's not gonna work. So let me, because I put too much on my plate. So that's what I would tell my younger self, like, don't try to do so much because you don't have to.
Well, Jordan, thank you so much.
Thank
Thank you
you.
for your time. Thank you for this conversation. You definitely have to come back because I have so many other points that we have to hit on. Um, but you are a wealth of knowledge, and I look forward to just jumping back in with
Me
you
too.
very, very soon. So thank you so much.
I'm ready.
All right.